Good morning, everybody. I am Mr. Antonio Laser for K-Laser. We are going to start this workshop by presenting Dr. Giovanni Licata, and I will leave you to his precious hands because I'm going to the operation room to follow the tightening phase live with Dr. Fundaro. So our dear friend Giovanni Licata will present his device. Thank you, Antonio. Thank you, K-Laser, for this chance. It is a great opportunity for me to be here for you. It is a restart, going back to normal activity, trying to go back to normalcy. I would like to thank all the people who gave their permission to participate and all attendees. K-Laser has presented a versatile, flexible, extraordinary, amazing device. Thanks to its small size, it allows for all office operations for us physicians. It has gotten one step further because we have gone into new platforms. K-Laser allows us to focus on a number of problems that we might find in practice and achieve the support of experts and professionals. Now I am going to focus more on practical experiences. We have targets we need to treat with our laser device. We have melanin, LL, and these are especially focused by the laser array according to the wavelength. The graphic curve for the absorption of tissue shows the great wavelength variety and peaks that can be achieved by and per every wavelength. This has allowed us to develop many tools, many laser platforms, each for one specific wavelength and a specific problem issue. Beyond enriching our knowledge on laser technology, in the physician's office, we would need a lot of space to use all of these know-how technology. So with the introduction of diodes and nanotechnology, it was therefore possible to create portable devices. I have one here next to me, and you can also see it in the slide. The size is incredibly small, but it is incredibly big and large in terms of opportunities. This device has the 445 nanometer, 10 watt, 107 free watt, and then a super guiding light, 690 nanometers, which has a biostimulating action. Therefore, as you can see, we are going to work on the various aspects of light, infrared, blue, and red. And this is the turning point and key feature of this device. So we can have more than one targets simultaneously. We are made of more components in our tissues. The spectrum has already been illustrated to you all, and delving deep in the ways in which we are able to use this device, we can see that there are enormous opportunities. Technology meets our requirements thanks to a devoted software platform for the specific cutaneous problems of vascular biostimulation. There are really many possible applications and functions that we are discovering in clinical practice day by day. And everything is very easy and simple thanks to the software. In the screen, you will find a type of lesion and the preset parameters. Therefore, the operator will be able, after a training course, to use freely. You can assess and decide the intensity, the power, the type of pulse via an user-friendly touch screen. This is an example of a cutaneous fibro, and preset software tells us how to approach the problem if we want to work on the surface or in depth on the tissue. I'm now going to share a video with you, and here you can see how simple it is to use the laser. It is for non-contact surgery point, and these are the outcomes immediately after treatment. It's truly very simple. So other examples of clinical cases, before and after pictures. It is a very soft and delicate action, a manual intervention. The operator will need to learn how to operate the tool, but it's truly very rapid. And as I said, the outcome is perfect, especially for cutaneous lesions that have to be tested dermatologically before you approach it with the laser therapy, especially in case of melanosis. Other examples, the lady of the video. I would like to remind you that in a laser dermosurgery, it can be achieved both via contact and non-contact operations with a specific laser point. With pliers, you will be able to eliminate the tissue as if it were a knife, surgical knife. Another fabulous application of laser therapy is the application for sebaceous cysts. As a surgeon, I would have needed to carry out an incision and then stitches, and even if you're very delicate, stitches are stitches. Instead, with laser therapy, you are going to remove the cyst, and by a very small pierce or hole, you will eliminate the content of the cyst, and the aesthetic outcome is really incredibly beautiful. These are other pictures, and I have received these pictures by some colleagues who have pitched them in to me. Another possibility of K-laser is the use of blue light for vascular surgery. And vascular surgery may be used for superficial problems, angiomas, angioplasies, And in this screenshot, you can see that we have a menu devoted to vascular surgery for the lesions that need to be treated. You will change the laser point because the length of action will change. We change the focus on the target in a different way, depending on the type of lesion, whether it's superficial or vascular. You see, we eliminate the lesion very, very easily, and there are no problems for this type of treatment. I have never had side effects. Compliance with patients is truly high. If there are some problems of pain suffered by the patient, you can apply anesthetic topical creams. There are many available, and the procedure is extremely rapid. An angio and the small capillary veins really disappear. This is a clear example of the classic angioplasty on the nose. Another before and after example. On the mentum, on the jowls or cheek, if it is a wider problem, you will need a little bit more time and dedication, but the problem is going to be solved. Another problem that can be solved is the photocoagulation of the venous lagos. I have tried it. I was skeptical at the beginning, very non-intense anesthetic on the lip, and the result is rapid and long-lasting. The patient normally tells us, had I known it was going to be so simple, I would have undergone this treatment much sooner. Yes, and in fact, it is true. The problems are solved very rapidly, and it appears to be very, very simple. The patient may believe that the technology is simple, but of course, the technology has been profoundly studied, and it's state of the art and allows us to achieve perfect results. The blue light sometimes will not allow perfect pictures to be taken or videos to be taken. We, of course, wear protective glasses when carrying out this operation, so we do not have any problem. But of course, the result for the video is not optimal. Now we're going to hear a colleague who is going to explain how to use laser therapy in more than one sector. We're going to show scleroangiolaser, a treatment that has laser and sclerotherapy to the resolution of capillary veins in the upper and lower limbs. The causes are linked to genetic reason. The areas have estrogens that generate a dilation. Before treating the capillaries, so you have to carry out a checkup to eliminate the possibility of a saphenous problem. Once you have eliminated this cause, you can start this treatment. It was started 7 years ago, and it's a laser on sclerotherapy, so that laser therapy will be more long-lasting. Initially, we inject the Samson on the capillary. It reduces the diameter of the capillaries, slows down the blood circulation inside, and then the laser interacts with the capillaries and destroys it without creating a cutaneous damage. In this type of laser treatment, we can use it on stellar angiomas or Rubens angiomas on the body, on the lower limbs, on the legs, to solve the problem of capillaries. It is fit for patients who do not have plaque psoriasis. This laser can adapt the energy of the laser, connecting it to the type of phenotype of the subject. The treatment lasts 30 minutes. You cannot, if you cannot eliminate everything in the first session, you will repeat these sessions after an ultrasound and will allow us to understand how many sessions are necessary. It's not painful. We will use a topical anesthetic that allows us to inject without the patient feeling pain. It does not have any side effects nor problems. And for a month, you should avoid exposure to the sunlight. Normally, these treatments are carried out in the fall until the month of May. It is a treatment that will solve the venous problem. Once you have eliminated the capillaries, they are gone forever. Of course, they may be formed again. This goes to show how treatments may be associated for the different pathologies. Initially, I did not work on leg vascular issues, and then I started treating them and achieved good results and compliance. The period of the year in which you can act is limited as per laser therapy. These are, again, other examples of before and after in vascular therapy. There is hyperemia immediately after. The coagulated vessel inside can release or may release a sort of footprint, and there will be the shape of the vessel under the skin, but all you need to do is reassure the patient it has not become darker. It's just going to be eliminated little by little. Freckles, sun freckles, and age freckles. These again may be treated by blue laser with the long wavelength on melanin. Again, we have a devoted menu in the device. You can choose the skin type. Parameters are preset, and we can increase or decrease our energy. This is a sun freckle. This video clearly shows the popcorn effect, as is called. That shows that we have achieved the result we expected. A word of advice: after you have treated the area, do not scratch or touch the lesion. Leave it as it is. And if you have a halo, you should further treat it in a second session. Other example of before and after treatments. An example of a dear friend of mine. He has shared this patient case with me. He works in the same hospital. He has treated hyperchromias with the device, with this tool, and you can see how everything evolved during the treatment. after first, second, and 4 sessions, the problem has been reduced. Again, you can really see how it is impactful in reducing the problem. Anti-aging protocols, how can we use this wavelength, even in fractioned or ablation mode, to improve the quality of our skin? A specific scan allows us to fraction the impulse we deliver, and with the fraction laser treatment, we cause a controlled damage that will stimulate cutaneous trophism. This is a paper that shows how the different treatments work. This is the device, the scanner. As you will see in the video, it is applied on the skin of the patient, and you can use it on a large scope of pathologies. I do not have the clicker to change the slide. And you can really gauge the type of application. These are the treatments that we can set up: soft, medium, high, hard. And in this way, by working on the skin, we achieve a skin surface that will allow us to achieve a wonderful resurfacing. This is the impulse on thermal paper, and this is what would happen on skin, on the derma. And so the result that is achieved on the skin of the patient is similar. No pain at all, no suffering. The patient is relaxed during the treatment. The patient only feels some warmth on the face. So you will achieve results without creating damages, as happened in previous treatments. So you set up with the client 2 or 3 sessions, and you integrate other therapies like biostimulations to have an onset of cutaneous trophism. And these are the wonderful results achieved. The skin quality is really improved. Of course, I tend to repeat that these treatments have to be carried out together, not just one treatment, but a bundle of treatments that allow us to achieve not just one result, but 10 results simultaneously. And again, you see before and after. It depends, of course, on the type of patient that undergoes, a client that undergoes treatment. The skin's quality improves also on the neck and hand. We are able to work also on very delicate skin parts like the eyelid, under the eyebrow, and with a couple of sessions, we have the possibility of achieving a tensage on the upper lid. Again, some before and after pictures to show the positive results. We can achieve this also with the laser stimulation of the various that can be achieved by the machine, the laser, also on stretch marks. An example of cutaneous rejuvenation on the face. And if we want to treat the face cutis for a repeated treatment, we can also have a biostimulation.
La luce blu, il trofismo cellulare, ha un'azione, come vedremo, anche proprio disinfettante sulla...
All you need to do is disinfect, and the effect is extremely clear. These are some other examples before and after. The dermis quality of the client improves incredibly. The acneic nodule inflammation disappears immediately, and after a number of numerous sessions, well, maybe 5 are enough, these are the achieved results. Another pathology that can be supported is onychomycosis, which is truly difficult in the physician's office. The client arrives and the patient is unhappy because they have resorted to any possible treatment available, and nothing has improved their situation. With onychomycosis, I propose laser therapy, and in fact, objectively, look at the results. The treatment is extremely simple, no pain whatsoever, just a little bit of heat under the nail. It would be a little bit complicated if we were to use an anesthetic, but it's not necessary. Look at the results. I have many slides, and this is why I'm showing them very rapidly to you, before and after again. And this type of result was never achieved in any other way. Another application, assisted laser liposuction. In this case, you use the laser inside, and it is an endogenous application for liposuction. We have a preset software application. You connect the machine to the liposuction attachments. You can use laser to suck up the type of fat that has been sucked in, and it is much better than a liposuction, classic liposuction. So the technique is carried out on the panniculus of fat, and this is how the fat is then sucked in. Look at the results of Dr. Serraglio. He has treated many patients or clients with this technique, and they are all happy of the attained results. Beyond reducing the fat panniculus under the cutaneous layer, we achieve an improved look in terms of the skin and its tone and firmness. The arms, the upper limb, you can use it on the thorax. Another endogenous application of K-laser blue is the remodeling of the lower third medium. Without entering too much in detail, since we're going to have the live connection with the studio, you can achieve a very good results in photo aging and volume loss. And the functionality is positive, especially because you gently work beneath the skin surface, and you can do that in your office. You don't need to enter the operating room. Look at the reshaping of the face. And we have now the live connection with Dr. Fundarò, I believe, but let's keep looking at other pictures. We have many international colleagues. This one was from Spain. This is my case, another one of mine. So the ability is astonishing. Thanks to this device, I was really struck by the so many positive results that I achieved day by day. They're better and better, and the scope of action and the typology of conditions and pathologies are really broad. So thanks to its small size, it is portable, as I already told you, allows anybody to, carry it around, travel by car, by ship, by plane, and move from one city to the other to use it. So now I would like to have the live connection with our colleagues. We we haven't got the connection yet. So maybe before the live connection starts, we can open the floor to questions. Follow up. For the follow-up, but for which pathology? For liposuction, it may be a couple of months. And so follow-up is after a couple of months, because you will have an edema on the tissue before that, and an endogenous irradiation of the third median. The patient will wear a protection. There will be an edema, and then the reduction will continue, and after 6 months, the result is final. I apologize, but I cannot hear the questions as they are not asked in a mic. Follow-up depends on the skin recovery, of course. Therefore, the second or the third session that then will have a follow-up required after 2 or 3 weeks. No second treatment can be carried out at least before 2 weeks have passed.
Tutto chiaramente dipende dalla
It
potenza.
all depends on the impulse power. Of course, CO2 has a more spot-on action, which has a perfect perfection in response to the blue light, because CO2 is absorbed by water, whilst blue light is not absorbed by water as well. So there are differences. We should compare with the same vat power and spot. The blue light is more superficial vis-a-vis CO2, so it is more gentler, and this is clearer with mucoses. I have not delved on that, but you can use the blue light in the oral mucose and vaginal mucose as well.
Mi interessava capire un attimo, utilizzando lunghezze d'onda.
By using 445 wavelength and 470 are therapeutical. We've used 445 on melanocytes, vasculars, arteries, veins. The other one has a peak for water and offers tissue ablation. So 970 can be used, yes, for both pathologies, and the tightening is not only linked to one action, but it is the set of more actions. So the same vascular damage that will become fibrosis, the tissues which undergo the indirect warmth on the target will produce connective tissue. So it's a cascade of events which will then achieve an improvement of the tissues. There is a question on the chat. I see in the video that very often the tool is not held perpendicularly to the skin. Wouldn't you achieve a better result by maintaining a right angle contact with the skin? No, it's not true. If we apply the tool vertically, we achieve a 100% action. But considering the size of our spot, well, these are small, and so the difference is minimal. If, for example, we are treating a vessel which is cylindrical and not flat, totally flat, the ray will really go and touch the surface, irrespectively of the angle at which I hold the tool. From the chat, they thank you for your reply. And I thank whoever has asked me the question. I apologize since I arrived a little late. For the jowls, the endolift, what do you use? It's an optic fiber, which is introduced by with a devoted tool. I don't have it here with me, or else I could have shown it to you. And is it flexible? Yes, the optic fiber is flexible. It's very similar to the flexible needles we used in the past. It is mounted on a very small pen where you can attach the fiber so that it will not move, and via very small hole and pierce that you carry out on the skin, as we're now going to see as soon as we are connected, you introduce it. The jowls are measured by the device, and we have a direct vision of the jowl itself. What about complications? All laser devices have to be used with caution. The medical complications that we may get with laser treatments is over-treatment. When we remove fibromas, for example, there is a varicose component inside, and once we have treated it, we don't need to insist until it is eliminated and it comes off. All we need to do is achieve a whitening on the skin, and then we are sure that we have treated that small lesion. Thank you. We unluckily do not have any information as far as the live connection is concerned. Well, since we're here together, maybe we can have the camera operator really focus on the different tools of the device. We have numerous pens and tips that we can use. They are all interchangeable. This is the device. It is very small in size, as you can see. Oh, let's see, maybe we have the live. No, we don't. So this is the device. Very small size. Look at the comparison with my hand. This is one of the various pens that you can use on the skin. I don't know whether you can see it from the video. It is directly applied on the surface of the skin. You can change the various tips. This is for vascular treatments. And this is for spots, for example. This is for surgery. They're all attached and mounted. I apologize, but I cannot handle both the device and the microphone. It has a bayonet mechanism, very easy handling. It's perfect to use in your practice, in your office. This is for fractioned treatments. It has the focal distance already preset for facial treatments. So you can carry it around in two small cases, and you have at your fingertips the possibility of carrying around and using numerous conditions, numerous pathologies. You use it with a wireless pedal, and this again is incredibly positive because you will not have, cables and wires on the floor that you may trip into. Now it's under charge, and you can move it around from one side to the other of the practice or of the operation room. It is on wheels. Therefore, the ease of use is really very, very high. Sorry, I cannot hear the question as it's not asked in the mic. it is difficult to tell the patient you need to remove the makeup, of course. Normally, clients arrive with makeup. Sometimes, I have informed the patient, the client, please do not come with makeup to our appointment, and they are absolutely scared. Melasma, as we know, it is one of the dire problems of our practices. The example I showed you earlier with the results of the Lantera photograph are quite satisfactory. There is a reduction of melasma of 50–60%. I believe that a reduction and elimination 100% is not available, is not something that has been achieved ever. Again, I apologize as I cannot hear the question.
No, no, non nessun problema. Una crema idratante messa la mattina, no, è importante che non ci sia nessuno schermo tra la pelle del paziente e noi, il laser.
We should not have a screen between the skin and the laser.
Speriamo non ci sia nessun inconveniente tecnico con la saletta.
I hope there are no technical glitches with the connection, the live connection to the other hall, to the other room.
Scusami ancora, il laser viene venduto con tutti quanti gli accessori oppure...
Is the laser sold with all of its accessories, attachments? I believe so. You should ask Antonio, because I'm not in charge of the commercial aspects of the device. Oh, we are receiving the first images from the room. Can you hear me in the room? We can hear you. Great, perfect. Then let's move into the live demonstration. Please, I'd like the cameraman to really film the laser. Please, a shot, a close-up on the laser, blue laser, to carry out this type of treatment. All you need to do you choose the lightning phase. Your connection froze. Can you restart, please? I was saying it's extremely simple to set. Everything is preset. In fact, it's very user-friendly. You click liposuction or body face, skin tightening phase, and immediately you have a screenshot that will start the specific laser frequency, 445 blue, 970 infrared, and 660 red with coaxial emission, and they are all delivered simultaneously. This is the pen we will attach to the optic fiber that will emit light so as to carry out skin tightening. The procedure needs to be carried out in a sterile environment. We prepare the sterile environment. It's very quick when you operate it. We have already applied the anesthetic and the submandibular and submentis area. The client has scarce adipose tissue, and the laxity is pure with no adipose excess. So we started the Bluelaserlift procedure. The cannula we are going to use to insert the optic fiber that is here at the end of the cannula, just 2 or 3 millimeters, you can see here. I will give Antonio the other tip of the optic fiber that is connected to the laser pen. Okay, come a little bit closer to me. So, sterile environment. We disinfect the area. The eyes of the patient need to be covered because we are using laser light, so hazardous in terms of ocular damages, so it is mandatory to use this precaution. I also would like to prepare the area. You fold it up, you cut out the area that you are going to operate on. So here we are. We already carried out an anesthetic procedure, but I will carry out another one. As anesthetic, I use decline with lidocaine and 22-23G cannula. You see that the area is anesthetized so as to allow the procedure with no pain. If you have any question during the treatment, I will be happy to answer if it's not too complicated and will not distract me from my treatment. Now the anesthetic on the submentis area. I hope it is possible for you to clearly see via our video shooting. So now we are ready to start.
Quindi inseriamo la nostra cannula in questo.
The cannula now. Here.
Scusate un attimo, ottimizzo la porzione che sposta.
Just a second, I need to.
Ecco qua. Ok. E
do this operation of optimization. Now we enter via this hole with an 18G needle. Please allow the pedal to come to be closer to me. I insert the cannula completely. As you can see, Once it's inside, I activate the laser and retract in this way. It is very important to do it in retraction, because if I do it whilst inserting the cannula, I would act excessively on the derma, sorry. So this is how I achieve the procedure. You can already note the tightening on the mandibular line or profile. You can also draw some lines, sketch some lines to facilitate the number of procedures. I carry 3 or 4 out. No pain whatsoever for the client after the anesthetic has been injected, of course. And you can really note an immediate improvement in terms of the mandibular jawline. I am taking a little bit more time as I'm simultaneously explaining it to you, and I'm performing the treatment slower so as to allow you to follow it. This is a perfect patient for or client for this type of treatment. The cutis is of perfect type. Look at the mandibular profile. It has already achieved a better definition. You have to check that the optic fiber is still on the tip of the cannula, because sometimes the optic fiber wears out slightly and reduces its length. So you need to always check. It is a couple of millimeters long on the extreme tip of the cannula. Now with an 18 needle, I increase the hole so as to facilitate the cannula insertion. So if you don't use the laser for some time, it will switch off. So I need to switch it back on. Here, I enter via this insertion, 18G insertion. I have a question. May I ask it? Yes, of course, sure. The optic fiber may be re-sterilized after you've used it. How does it work? Please explain. Yes, and the autoclave. 10 times you can use it, and then you have to replace it because it loses conduction. Can you see a little bit better? So the only bleeding you get is at the insertion holes. I did not use lidocaine with adrenaline when I did this operation. It is better to do that. I didn't. I'm sorry, this cloth, the sheet here does not allow for perfect filming. The laser has to be parallel to the cutaneous line or profile. Now we extract it. Last treatment in the submental area, mentis area of the chin. Tell me the time so as to know whether we have time to treat also the other side of the client. I apologize, but the cloth here is really a bother. It's bothering me and you.
Direi che a questo punto abbiamo
Very well. I believe that we have concluded the treatment. I can extend also the treatment in the lower area of the jowl, and here in this area to give a better skin tightening in this area. Maybe I can show it to you very, very briefly. Let me see if everything is okay with the optic fiber. So this is a procedure that can be carried out in your office, in your practice. Here, you can enter also through here. And we can cross over the treatment lines.
Il tutto con estrema facilità, 3 o 4 passaggi sono più che
2 or 3 are more than enough. You see the retightening already. This effect can already be seen. It's notable.
Una situazione di leggero edema dovuto anche all'infiltrazione che abbiamo.
There is a slight edema. I do not have enough time to show you the other side, but it is exactly the same topology, the same procedure. The patient, the client, will receive the application of sterile strips on the insertion holes. And so we cover it up in this way. We need to dry up the blood on the skin, and we apply the sterile strip, which should also stop the bleeding. A very small band-aid, please. A patch will help us. Sometimes in extremely thin patients, bleeding can be more abundant. I would also like to show you how the client is then
che si trovano anche su siti internet.
Allowed to go home. We use these sort of sheaths or membranes. You apply it like this, and it will compress the treated tissues perfectly. This stage is extremely important because it will position the tissues that we have stimulated with the laser. There will be the good fibrosis, and the results are enhanced. This is something that needs to be explained to the patient beforehand. It should be kept for 7 days. Normally and luckily, patients take it off after 3 days. This is a typical treatment that has to be carried out on a Friday so that on Monday they can go back to work without having any signs of the treatment that has been carried out. I believe we do not have any more time for the live connection. I have a question for you. Do you use threads together with the lasers? Well, you see, I'm using K-laser with suspension friends plants and the compression sheath for 3 days. This will allow me to reposition soft tissues thanks to the threads. We have, of course, stimulated the subcutaneous tissues. And so this will enhance both effects, the skin tightening and the thread traction. So this is something that can be matched, can be done together, even because the anesthetic I injected for the K-laser treatment is also exploited for the thread treatment. So first you carry out the K-laser and then the thread. And so you will have an optimal outcome of the procedure. Do we have questions from the room? Be reminded that this technique you saw is skin tightening, but by clicking and selecting the dipole laser treatment for facial treatment, it's no suction, different setting, but the same cannula for K-laser. And you can have a adipolysis effect. The edema will require more time to be reabsorbed because of the inflammation in the area caused by liposuction, but with rolled up gauze, you can try and eliminate that effect, or a lipofilling cannula, you extract, you suck the fat that has been liquefied. I'm told that we are now late and I have to close. No, one last question. Are the threads in polylactic acid or what material? Polylactic and polycaprolactone. But what about the heat? Will it not dissolve the thread? No, I first treat with a laser and then I apply the thread. Thank you very much. Then the time at our disposal is over. Bye-bye. See you next time. Bye.